My name is Alexandria Kaskowitz, and I'm here to introduce everyone to our nursing theorist, Ida Orlando. This project was done by Roberta Thornton and myself for our advanced nursing theory class. All right, let's get to know Miss Orlando. Ida Orlando was born in 1926. She was a first-generation Irish American. Ida found her passion in nursing and graduated from New York Medical College in 1947. Her highest level of education was a master's in mental health nursing, which she obtained in 1954 from Columbia University. Later in her career, she was a nurse educator and specialized in mental health psychiatric nursing. Orlando was employed as an associate professor at Yale School of Nursing and served as the director of the graduate program in mental health psychiatric nursing. During her time at Yale, the college received a grant from the National Institute of Mental Health. The research from this grant led to Orlando's development of the deliberative nursing process, which she published in 1961. She theorized that the nurse-patient relationship was dynamic. This research led to the birth of her theory. Her contributions to nursing continue to be important to this day, including viewing the patient holistically and using the nursing process, assessment, diagnosis, planning, implementation, and evaluation. This is the nursing process still taught in schools today.
Hello, my name is Roberta Thornton, and I will be presenting over Orlando's nursing process theory and nursing practice. A little background into this theory: Ida Orlando in the 1950s, using a government grant, began to study mental health concepts in nursing curricula. She did an empirical study of over 2,000 records of nurse-patient interaction, and her nursing process theory was developed. Her theory has been described as prescriptive. Others have described it as an interaction theory, but Fawcett describes it as a middle-range predictive theory. However, Ida Orlando describes her theory as a nursing process theory. It is a patient-centered reflective practice theory based on discovering and resolving problematic situations. If a problem is not discovered, it cannot be solved. The framework of her theory revolves around 5 interconnected concepts: the function of professional nursing, presenting behavior, immediate reaction, deliberative nursing process, and improvement. The function of professional nursing goes over nurses' unique function, and that is finding out and meeting the patient's immediate need for help. We as nurses are going to provide direct care and assistance to the patient's needs in order to help relieve the patient's sense of helplessness. Presenting behavior. The focus of her theory centers around the nurse-patient relationship, which is dynamic, fluid, and reciprocal. It is an exploratory process where both verbal and nonverbal communication are assessed to help identify the problem. Immediate reaction. This concept discusses the nurse's internal response to the perceived patient need, which is automatic and instantaneous. A feeling is developed by the nurse, and then the nurse acts. The nurse's immediate reaction is unique to each situation. Deliberative nursing process. The nurse, during the interaction with the patient, undergoes a complex process in which observations and the patient's behaviors are used to understand the patient's immediate need. It should be noted that a nurse's personal responses can cause conflict. Improvement resolution. After discovering the patient's problem, a resolution can be established which provides immediate help to the patient in meeting their needs. The results are what is evaluated, not the nurse's interventions. During the literature review portion of this poster, a search was done on several nursing databases, mainly Ovid and CINAHL, using key phrases and excluding journal articles that were more than 10 years old. 3 relevant articles were used to show how Ida's theory is currently being used. The first journal article that was relevant was over communication and technology. It came from a peer-reviewed journal, and it discusses how technology and healthcare can affect nurse-patient communication. It uses Orlando's nursing theory as a framework on how to promote better communication and better patient education between nurses and patient. It reviewed several studies done in the 1960s that discussed the interaction and communication between nurses and patients. The results from this article where interpersonal communication continues to be critically important to patient education and in turn to overall patient care. Orlando's theory can be a framework for the development of communication skills among nurses. The second journal is Nursing Students' Immediate Responses to Distressed Clients based on Orlando's theory. This also comes from a peer-reviewed online journal that explores the relationships between nurses and clients. It's in a simulated environment, and 60 nursing students' responses to distressed clients were analyzed by dimensional content analysis. Findings from this study indicated students needed more work on how to communicate and educate patients. Using Orlando's theory as a framework, it can help to guide interactions and education. Lastly, an article over improving documentation of patient progress through role empowerment of the head nurse using Orlando's theory approach was further researched. It also came from a peer-reviewed online journal, and it explores the quality of nursing documentation using the deliberative nursing process theory as a framework. 115 progress notes were selected through cluster sampling technique, which were analyzed and tested to evaluate effectiveness. Findings resulted in significant quality improvement of the implementation of progress note recording, following the intervention of the head nurse's role, using empowerment by the Orlando theory approach. Thank you.
All right, so let's apply Orlando's theory to clinical practice. Orlando's nursing theory to explore postoperative care and medication regimens. So let's introduce our patient. We have a 56-year-old male patient that is 2 days postoperative from a bowel section. The patient has been doing well and participating in cares. He is on electrolyte protocols and has needed several bags of IV potassium replacement over the last couple days. Today the patient is refusing to participate in cares and states, "I'm not up to it today." The nurse utilizes Orlando's theory of the dynamic nurse-patient relationship in the nursing process to identify barriers and improve patient outcomes. So the first function is the professional nursing function, or the organizing principle. The nurse's function is to assess the immediate needs of the patient and determine if a need is unmet. The nurse assesses the patient's apathetic statements and lack of participation in cares as an immediate need that needs to be addressed. The next step is to determine what the problematic situation is, and this can be done with the patient's presenting behavior. The nurse, with the collaboration of the patient, identify the problematic situation. Both the patient and the nurse participate in an exploratory process to identify the problem and solution. The process utilizes both verbal and nonverbal cues from the patient. The nonverbal cues that our patient is showing is guarding of the IV site, and the nurse assesses redness and tenderness to the IV site and grimacing when the patient moves his arm. The verbal cues that the patient is telling us is that he's not up to activity today, and he's asking, "Why am I still getting medications through my vein when I am eating well?" So the immediate reaction of the nurse, which is usually an internal reaction or an internal response, The problematic situation triggers an immediate reaction from the nurse based off of critical thinking and expertise. The reaction is immediate and both affective and cognitive. The nurse's immediate reaction is to stop the IV potassium and assess the patient's ability to tolerate oral supplementation. She emphasizes with the patient about the pain that they're experiencing. As an advanced practice nurse, you would want to also assess the current medication regimen and change supplementation to oral if applicable to your patient. The nurse can correlate the patient's reluctance to participate in cares to pain from the IV site. The next step is the deliberative nursing process. This is the reflective and resolution stage. The patient's behavior is affected by the nurse, and the nurse's behavior is affected by the patient. The nurse was discouraged to see the patient not wanting to participate in cares, and the patient was having increased pain. But by utilizing Orlando's deliberative process theory, the patient and the nurse together worked to solve the problematic situation and help the patient meet their needs. The nurse's function was complete once the patient had all of their needs met.